Hi, and welcome to a new report, Catalyzing Mental Health Support for Moms Through Specialized Peer Support Training. I'm Madeline Halpern from MHA National. A few housekeeping items. Today's session will be recorded. The recording and slides will be sent out to all participants following the event. And we do not offer CEUs for attending our webinars. However, there will be information at the end regarding how to receive a certificate of attendance. Today's speakers are Erin Foster, who is Recovery International's Director of Recovery Practices and Consulting and Education. He also serves as the Director of Education for Recovery International's licensed private vocational school in Phoenix, Arizona. He is a certified recovery support specialist, a certified rehabilitation counselor, and a licensed associate counselor. Erin is an advocate for the inclusion of peers in the mental health services field and collaborates with institutions of higher education to develop research to support workforce development for peer support roles. Erin continues to consult nationally on the efficacy of peer support and recovery education in the American Integrated Health System. Joy Burkhard is the founder and executive director of 2020 Mom, a nonprofit social change organization aggressively working to close gaps in maternal mental health through education, awareness, and advocacy. 2020 Mom's projects include the brands Mom Congress and the Blue Dot Project. Mom Congress is a coalition of nonprofit organizations and individual members working to improve birth and support of early motherhood, and the Blue Dot Program, a national awareness movement for maternal mental health, which hosts the U.S. Maternal Mental Health Awareness Week social media campaign. In addition to running 2020 Mom, Joy also works part-time for the insurer Cigna, where she has spent nearly 25 years. She serves as a regulatory affairs leader and has a passion for quality improvement and innovation. Joy is a member of the American College of Obstetrics and Gynecology Expert Work Group on Maternal Mental Health and the California Maternal Quality Care Collaborative, the nation's first agency working to solve the U.S. maternal mortality crisis. She has been recognized for her leadership and vision with several awards, including receiving the American Public Health Association's Maternal Child Health Leadership and Advocacy Award, California's American Mother of Achievement Award, the Emerging Leader Award in Women's Health from the Federal Health and Human Services Agency Office of Women's Health, and Cigna's Volunteer of the Year Award. Joy lives with her husband and 2 elementary school children in Los Angeles, California. Tanya Fulwide is MHA Ohio's Associate Director. Tanya oversees the Community Engagement, Education, Healthy Connections, Get Connected, and POEM programs. Tanya is a certified mental health first aid USA instructor and also teaches de-escalation, work-life balance, and perinatal mental health workshops. She is the co-founder of the Perinatal Outreach and Encouragement for Moms, POEM, formerly a nonprofit organization now within MHA Ohio's umbrella of services. POEM is one of the largest and longest running programs of its kind in the U.S. and was the recipient of the 2017 Programs and Care Award from the Macrae Society of North America and 2020 Mom. Tanya is a Postpartum Support International Founders Award winner for her outstanding contributions to related emotional health and childbearing, and is co-author of PSI's guidebook, Developing a Sustainable Perinatal Support Network in Your Community. She is a graduate of The Ohio State University in Political Science and Communications. Cindy Herrick is a mom and fierce maternal mental health advocate with an interest in peer support and social media support and advocacy. Cindy is an experienced special education graduate instructor and conducted research at Arizona State University. She serves as 2020 Mom's nonprofit and medical partner lead and runs the Blue Dot Project's Maternal Mental Health Week and suicide awareness campaigns. In 2019, Cindy became one of the first peers to be trained as a maternal mental health certified peer specialist. with that, I'm going to hand it over to Joy.
Great. Well, thank you. And clearly we have a very esteemed group of people joining us today. Welcome everyone that's joining us live and also listening to the recording. We have about 400 or so people registered, and we have about 180 of you joining live today. So thank you so much for being with us. We're really excited to talk to you about maternal mental health and the power of peers in this space. So a little bit about 2020 Mom. Our mission is to close gaps in maternal mental health care. And we really believe that if families, employers, and society are paying for healthcare benefits, right, in the health delivery system, that those benefits ought to be available to detect, screen, and treat these disorders. A quick quote about us, that we're really focused on involving multiple stakeholders to understand barriers and to solve problems, including identifying solutions like peer support as an opportunity to solve these gaps in maternal mental health. We always start with these statements when we present on maternal mental health, and we recognize some of you know these statements and have heard them, but some of you may not have. So did you know that women in their childbearing years account for the largest group of Americans with depression? Did you know that the American Academy of Pediatrics has noted that the prevalence of depression and anxiety in teen girls is skyrocketing? Did you know that maternal depression is the most common complication of childbirth? And did you know there are more new cases of mothers suffering from maternal depression each year than women diagnosed with new cases of breast cancer? And despite all of this, maternal depression and the range of maternal mental health disorders, which we'll talk about in just a moment, still largely go undiagnosed and untreated. And this, of course, we know is unlike other mental health conditions, and that we're all kind of in the same boat. So here are the range of maternal mental health disorders. The baby blues, which is actually not a disorder, but 80% of women, research indicates, will suffer from adjustment in the postpartum. Some actually hypothesize that this can happen during pregnancy as well. Depression and the range of anxiety disorders. I now know that OCD is a separate disorder, not an anxiety disorder anymore, so we need to move that bubble out. But you can see here the range of anxiety disorders and OCD, and of course bipolar disorder. And then we, though it's not necessarily a separate diagnosis, but a feature, postpartum psychosis, we don't want to leave out, because this is when we know that women are more likely to harm themselves and their infant. And I think I'm speaking to like-minded people who understand those nuances. And break in reality can increase that risk. So what is peer support? I think many of you already know about this, and really the Centers for Medicaid and Medicare Services helped champion the concept of peer support, and recognizes that it's efficacious. There's evidence base for peers, those with lived experience, providing these services. And I'm not actually going to read all of this, but you can see these important statements here. And the point is that it's recognized as evidence-based. So what is a certified peer specialist? Well, you can see here, according to CMS, peer support providers, for those who become certified, must complete training and certification. That means a test to make sure that there's a certain baseline level of proficiency. That's all defined by individual states. Training must be provided, and a basic set of competencies should be tested to ensure that there is a backdrop to perform peer support functions. Over here on the right, you can see we note that those who take training sit for a test to become certified in their state. And every state except California has a certification process in place. And we hope that that will be changing in California due to some additional state policy that's been attempted for a few years, but it seems as if we're very close to the finish line on changing that in California. So what is also like magical about certification in our space in maternal mental health, we have seen peers providing support and counseling and sharing that you're not alone for years and years and years, and that's critically important. The magic sort of secret sauce around certification is not just the training and the certification for baseline knowledge. That's critically important in this space, but also the fact that once a peer is certified, that those peers that work with an agency that is billing the state Medicaid program can be reimbursed for their time. So at least 36 states are offering reimbursement right now for peer support specialists who are certified in their state. So what do peers do? I think most of you can imagine what they do, but let's just go through these high-level bullet points quickly. They provide emotional support, right? Camaraderie, like I'm a friend, I understand what's been going on. Information, so what are the range of disorders? And here are some of the things you might consider based off of what I'm hearing, including community support resources, etc. Instrumental in providing concrete support, so social determinants of health kinds of issues. Often peers provide support in this capacity too, not always. And then affiliation support. So maybe a peer would say, join the Postpartum Support International Facebook group. I also know there's a community over here that's doing something in our state. Want you to make sure that you know about these resources. So our field, we believed, our hypothesis was really that maternal mental health is ripe for the use of certified peers. And these are the reasons why. Like the whole country, there are shortages of mental health providers and super shortages of psychiatrists. There are even greater super shortages of what we call reproductive psychiatrists, those who have extra training and knowledge on how to treat women who are pregnant, the medications that are safe, the evidence-based, and those that are lactating. We also know, of course, that stigma is reduced when there is a peer involved. I hear from someone who suffered from something like me, it makes me feel more comfortable. It meets women where they are. So maybe a woman wouldn't feel comfortable, and especially, thank you Mental Health America, by the way, for the term, really promoting the term BIPOC, so Black, Indigenous, and people of color. So women who don't necessarily trust the healthcare system for various reasons, and rightfully so, could perhaps see a peer in a community-based organization that is billing Medicaid, and it meets her where she is and she feels comfortable being open and honest about what she's experiencing. And then, of course, increases access to services. It's cost-effective and also can provide meaningful career pathways for mothers, right, who really want to make meaning out of what they've experienced, may not want a full-time job, etc. And I now have goosebumps on my arm, so I'm really excited about that. So we ran a study because this was our hypothesis that, we really need to see about the existing certified peer specialist training that is available in many states, and whether it can be a chassis to provide support to mothers. And we looked at it similar to providing support to veterans, that a general program may not be all that we need here, and that it may be that a program should be unique to mothers. So that was our hypothesis. Funding was provided by the Hope and Grace Fund, our initiative, that's part of the skincare line philosophy that many of you, before we were on lockdown, all of us might remember seeing their products in malls, etc. This philosophy skincare line. We ran the pilot in Texas and Arizona, again with the hypothesis that we should be looking at whether these training programs work for mothers. Texas and Arizona, you might ask, why did you pick those two markets or states? A study that was recently run and is still not published by an organization, Sage Therapeutics, the pharmaceutical company, used existing research that shows from census data who might be at higher risk of suffering from postpartum depression specifically. They used census data and a piece of research by Deepika Goyal, a nurse researcher out of Northern California, and really predicted that these two markets have the greatest need. And so we felt like, let's augment what we know have to be treatment shortages and a great need there by running the study in those two markets. I do also want to quickly give a shout out to Michelle Lacey and Women's Health Innovations for providing overall project management support on the study. the measurement group out of Los Angeles for doing the research component. So we basically took the existing peer support training, that arrow in the middle, and we'll hear from RI and Cindy in a moment about that training as well, which included just basic 2 weeks of peer support. It was in-person training. That's what was offered at the time. Of course, now with COVID and for so many reasons, even in our study, that has changed. And 5 hours of additional training in maternal mental health was added. And again, kind of following that model, for vets, our hypothesis was that women need something a little bit different, and often because they're not diagnosed and treated themselves, that they need to make sense of their own experience and understand the range of disorders, even though they're not providing clinical support. That overview would be critical, was our hypothesis. Study design, I'm not going to go into all of this, but basically, relatively small samples. You always try to recruit more moms, and for various reasons, and study participants, it's really hard to recruit moms with new babies, as you can imagine, to get away for 2 weeks. So there's the study design. And the overall punchline here is that peers who otherwise would have been potentially providing service without this training reported an increase in knowledge about peer support, an increase in knowledge about maternal mental health, an increase in confidence, and an increase in, I can't see that last bullet point. Okay, maternal mental health support, confidence in particular. So really great results overall, which is what we had hoped to see, and it was what we saw. So there were a couple of things, though, we learned through the pilot that would need to change to make the training relevant and helpful and easy to get to, for example, for mothers. I'm not going to go into the challenges. Instead, I'm going to jump right over to what was recommended be changed. First is that the change recommended was that training of cohorts of just mothers be provided. And you can imagine that there are, in standard trainings, there are a range of different trainees that have different experiences. And there was actually, Cindy will have you talk a little bit about it, perhaps during the Q&A and fireside chat, but a little bit of a scary experience that happened during one of the in-person trainings in Arizona. And that was, the basis for, I think this would have been recommended anyway, that moms have their own kind of safe space and space to process just maternal mental health disorders together, that we integrate, instead of having 2 weeks, for example, of peer training and 5 hours of maternal mental health, that perhaps it be woven into the training throughout the 2 weeks, maybe 2.5 or 2 weeks, 2 days, for example, to get to all of the content. The other recommendation was that after training, provide guidance and post-training support. We'll talk to Tanya about what she does in the POEM project and what we're looking to adopt because of her expertise through this wider program. And then consider a job board. So I've been trained, but now what? Where do I get employed? I love the work, but now what? So just recommendations for how to use peers in the maternal mental health setting. So hospitals, right? Inpatient, high-risk mothers, for example. Support groups offered in hospitals could be co-led by clinicians and peers, or even led just by peers potentially that are certified in clinic settings. So wouldn't it be great if in large clinics there were peers on site, community-based or otherwise? And then community and nonprofit settings we list here. So helplines, voice and text support, Postpartum Support International's the leader in the space and really the go-to organization in the space for providing support. It'd be incredible to start to see some certified peers providing that support. Support group co-leaders, community-based hospital, etc. Navigation. So we're really interested in this concept, and I think those of you who do peer support outside of maternal mental health right now too know that the insurance system is very difficult to navigate, and we're very interested in adding a potential add-on training down the road around navigation. So, okay, I know that this is the provider in my community that might help me. I need more than peer support. It doesn't look like they're in network. What is a single case agreement? What do? I see they have certification. to treat mothers, a special training to treat mothers, and so that's who I want to see. So that navigation piece will come later, but that's a potential support that peers can provide in our space, and then direct provider referrals and ongoing follow-up just to check in when providers themselves can't do this work. So next steps, and then we get to open it up for our fireside chat, which I'm really excited about, is that Recovery International under Erin's leadership. You'll see Erin's face here live in just a moment, in partnership with POEM, Mental Health America out of Ohio, and with 2020 Mom Support kind of off the sidelines, is working on creating this integrated training cohort program. You'll hear in the fireside chat, like when would it really be available? And is it in my state? All those things. You'll hear about that in just a moment. We're considering 2020 Mom, a maternal mental health specialist peer job board, and would love anyone's feedback on all of that. If you have ideas or thoughts in the chat here, or the question, sure, you can put your comments. And then we're also planning on hosting an online community for those peers that become certified peer specialists in their states, providing maternal mental health peer support, and really looking to POEM, Tanya, who you'll also meet here in just a moment, to provide ongoing mentoring services for those peers that become certified at a national level. There's a couple of grants in the works to make all of this happen, one big one, and you can track all of this work and these next steps by signing up for 2020 Mom's e-newsletter. See our website on the screen here, 2020mom.org. We also have a page dedicated to certified peer support with lots of information on the study, the slides. The recording from today's session will be provided to all of you through Mental Health America, but it'll also be on that webpage as well. So I am now really excited to ask that our presenters here show their cameras, or go ahead and show your webcam. You'll start to see them pop up. You heard about the esteemed guest just a minute ago. Thank you, Madeline, for those great introductions. And there you go. I see everybody. Thank you so much. And there's Erin. Excellent. So as a reminder, you all have an opportunity to ask questions of our presenters today too. I'm going to start the fireside chat by asking my own questions, but feel free to use that question feature in the GoToWebinar control panel if you've got a burning question as well. If we've already answered it or will be soon, we will not be shouting out that question, Stacy on our team, but we'll be focusing on the questions that are not yet answered. So I'm going to start by welcoming Erin. Hello, Erin, Director of Education at Recovery International, RI, who was the lead in really helping to roll out training in Arizona in the pilot, and really excited about providing ongoing opportunities in maternal mental health. And so, Erin, I'd love for you just to help those that are new to peer support. Tell us a little bit about your work at RI, the states that you service, and then just remind us, so if there is RI is not in one state, is there somebody similar to RI in that state?
Certainly. So first I need to do a caveat. There is an organization called Recovery International. They are not us. We are RI International, Recovery Innovations. We always like to make sure that we're not representing a different organization. So just wanted to make that clear to everybody in case especially if there's somebody from Recovery International watching.
Thank you, Erin, for correcting me. I know that, and that was a misstep. So thank you.
It happens a lot. That's quite all right. So we have been around in 1998, 1999. We really looked at our services and said, how do we make these more recovery oriented? And at that time, we began working with Boston University to really build a recovery oriented campus of care. And in doing so, what we looked at was peer support and how do we integrate that into our services. In 2002, we began rolling out our peer support training. Since then, we have trained over 6,000 peers across the country and in other countries. We have also worked with a lot of different institutions of higher education to do research studies on the validity of peer support. And we have helped organizations and countries. We went to the United Kingdom to help to set up the recovery college system. We worked with other organizations And we have a base in New Zealand also. We have trained in over 37 states. We currently have a footprint, which is all of our services wrapped into one in 7 states, and we're looking to merge into 9 very shortly. So it's our philosophy is that our company is peer driven, and that is that peer supports aren't just frontline service. If a peer support can find value in our company in IT, in finance, in human resource, they bring that human component, that connection that peer supports can give to every part of our organization. So we currently employ more peer supports than anybody else in the world, except the VA. But we always like to say we train for the VA. So that's we're very excited about that. Over 60% of our workforce identify as someone with a living experience, and that's from board member right down to the very person who's sitting and that person that's walking in for their first assessment. Now, did I cover everything there, Joy? Hopefully.
You did. And Erin, actually one more point, if you don't mind. If you're not in a particular state as the training organization that the Medicaid state agency contracts with and provides certification for, there are organizations like yours in those other states?
There are, and many states actually have multiple trainers. I know here in Arizona there are 12 trainers. There are multiple trainers in North Carolina and in other states. So it really depends on the state you're in. Some states actually control the state certification. Sometimes they turn that over to an academic university of some sort within their state and say, you define the certification. And some, like Arizona, have diversified and said, let's get a lot of trainers out there so that there is choice, because choice is one of the biggest things that we do in peer support, is we offer choice. So let's give them a choice of where they would like to go. So what I always advise people is to look on, you can always, I really hesitate to use the word Google, so I'm going to use the word search. You can always search on the internet and just search peer certification Ohio, peer certification Arizona, peer certification California, which, as was mentioned earlier, you know, we're actually really close. We've been trying for a long time to get California to certify, and we're hoping this time it's up for the vote again. So we're hoping for that. But I would share with people to really look at the state. You can always also call us, because we keep a catalog of the different states and what they require. There's also, I believe it's University of Texas and University of Kentucky have done a really extensive search state by state, and you can go online and find that document, and it tells you exactly how to get certified in that state.
That's great. Thanks, Erin. And I know Mental Health America also has a list on their website, and 2020 Mom on that page I mentioned earlier is tracking some of this as well. So there's lots of great resources. Erin, thanks for the backdrop on certifying or training organizations in every state. That's helpful. Cindy, I want to move to you. Cindy was a trainee, as mentioned earlier, in the pilot in Arizona for mothers. And Cindy, I just want you to share as a peer, what was it like to go through the training? What did you maybe not expect? What did you expect? Did it exceed your expectations? Anything that you want to share with the group about what the training was like and the power of the training?
Yeah, absolutely. So just a little bit of background on that. I was actually part of the first cohort that went through it. So there were subsequent cohorts that came after us, and you know, Erin and I had talked about this before it happening. So I you know, just as a caveat, I had a little more knowledge going into it because, you know, I was very much a champion for bringing this peer support model into maternal mental health. So, you know, given that background, it was still, it was a lot to digest, and it was great. Like, it was, you know, there was so much great information, and, you know, having done informal peer support, like just mom to moms as moms support each other and things like that, it was great to have a rubric and to have, structure and, on the ethical side of things. It was great to understand these things and the reasoning behind certain techniques and things like that. So that was incredibly useful, and the practice was great, and as Erin had said, our instructors all had lived experiences, and we had shared all that, and that was really great for bonding in terms of knowing that you're not alone and having walked the path to recovery. But Joy, I think you had earlier mentioned about, maybe moms being their own group through training and things like that. I will say that, and I don't know, Erin, maybe you can speak to this with subsequent cohorts, probably got adjusted and things like that. But I think going in, we didn't know what to expect because it was a spectrum of recovery from all different fronts. So people who are recovering from all different things were in there. And so I think initially as a mom, and there were some moms that were pretty new moms, coming out from hanging out with your baby and, being in your home and things like that, it was a shock for some of the moms, and to acclimate to such a big change from what they were used to. And so, I know that was definitely noted in the report, and, subsequent trainings maybe have been changed and tailored, and, but the online format, I know we were the first to kind of do a hybrid online format, and, that was great that RI had worked with that to accommodate our schedules, because 2 weeks is a really long time to be, 9 to 5 for 2 weeks, and to get childcare, and if there were moms that were, it was just a lot of moving components, that are unique to moms. So, and that was definitely noted.
Great, Cindy, thanks for that background, and thanks for being one of the first certified peers in maternal mental health. And Cindy, I know would be willing to chat with anyone that's watching today or watching the recording that wants to know more about her experience. So Cindy, thanks so much. I'm going to turn it over to Tanya next, who, if those of you that are in the Mental Health America network don't know Tanya yet, you should definitely put her on your list of people to get to know in 2020. Really remarkable partner out of MMH, Ohio, and has really been leading the way in providing community-based maternal mental health peer support for years. As she mentioned, it has an award-winning program in the maternal mental health space as well. And so Tanya, welcome, and thank you for your many years of contributions. And I want to hear from you just a little bit about POEM. And also, we didn't share yet, we gave some insight into the fact that every state's a little bit different. What Tanya has made sure that we were all educated on, that there are some states that don't provide peer support certification yet for mental health, only substance use. So although in Ohio, Tanya has a really remarkable program that we'd love to be scaled everywhere, they're not certified peers that you're using because the state doesn't recognize or certify peers in mental health, only substance use. So Tanya, give us a little bit of background about your program, how long you've been around, what's worked well, what do you want to share relative to the new training program that's being launched, and what can be leveraged from your program for the national program?
Sure. I'm happy to be with all of you as always. And let me clarify really quick on peer certification. So Ohio does certify peers in both mental health and substance use, but Medicaid does not reimburse for. So there are all these, and how you keep track of each state and what each state does would be next to impossible, Joy. And I may have misrepresented.
Yeah, I knew that too. That's right. Thank you for correcting
but
me.
That's okay.
Right. Lots of nuances.
So so our peers can get certified in mental health. So there's a general certification. The challenge, and I think Erin has alluded to this in other states or in other situations too, that a lot of times the peer movement is largely based in recovery around substance use disorders. And so a lot of the trainings are focused around that. And I know RI is not one that does that sets them apart a lot, in that there's a mental health and SUD focus. But in our state, we find a pretty heavy focus on SUD, which then, which is wonderful and certainly be there, but it should also be mental health. And of course, the need for maternal mental health, as both Joy and Cindy and Erin have talked about, is that, all of us being, to use Cindy's word, fierce advocates for peers and for peer support, that truly somebody who can identify as somebody who really truly can identify. And what we know is that, experiencing marginalization, experiencing discrimination, it's so different. And you can't say I experienced this level of marginalization, therefore I can identify with this other piece. So truly being peers, when it comes to all kinds of things, it's important to recognize those unique experiences in people's lives. And what us maternal mental health advocates know is that the perinatal time period is extremely different from any other time in a person's life. And we have maternal mental health treatment specialists from the clinical end, and peers should be no different. So POEM, our program within Mental Health America of Ohio, and just to say, we did start out as an independent nonprofit organization, and then began to partner with MHA here in Ohio about 8 years ago, and eventually that resulted in a merger, which has been one of the best things that has been done for maternal mental health in our state, is partnering with MHA, and I really hope that more organizations, more MHAs start to offer maternal mental health programming. There've not been a lot of collaboration between perinatal mental health advocacy and mental health advocacy. So I hope that continues to grow. And I see 2020 Mom is a big leader in that too. So I'm super grateful for that as well. But at any rate, POEM, we have employed peers for a long time. And our focus, if back to the slide that talked about all the different ways that peers could be, of service and help really, like 2020 Mom says, close gaps in care and understand what those gaps are. We really do those kind of bottom four. So we don't sit in any clinical settings. We don't sit in hospitals. We sit, within MHA of Ohio and provide care navigation. So helping people access clinical care if that's what they need, access reproductive mental health specialists. We provide the peer support in a variety of different settings, from one-on-one mentorship to support groups to, just ongoing follow-up, and that's being around for a long time, 20-some years. What we've learned is what our health system knows is that direct referrals are the only thing that works. There's a reason people don't get mental health care if they're only offered a phone number, they're only offered go look on your insurance website. Got to focus on access and connecting into the system, and that's what we really focus on through POEM, is that making it as easy as possible for moms and families to access the care they need. But then we do it all through peers, which helps with that power dynamic. There's a lot of talk about, Joy, you talked about, people being comfortable with accessing the healthcare system, and peers can help really mitigate that significantly. So that's a lot of what we do. And I don't remember if there were other questions, but I'll stop rambling.
No, that's great. I'm going to ask a question, and just a reminder that our audience, we're going to take just a few more minutes for questions, and you're welcome to ask one. I see one in the question box that we haven't addressed yet. But before we get to that, Tanya, can you tell us, so you serve as the navigation between healthcare systems. Can someone find your program, your community-based program, because a provider, like an obstetric provider, screens the mother and finds that there's a positive strain and then sends that patient to you, or can the mother also find you directly?
It's all of the above. So the majority of the moms and families we work with do come to our program directly from a provider. They come from an OB, a pediatrician, a community health worker, a home visitor, anyone. We really feel like if you're already accessing care, whether you're pregnant or postpartum or in that first year, we don't want to have you to take that extra step. So the majority of the moms, the provider talks to them about mental health complications, whether it's through a formal screen, which we do advocate, but Ohio does not require it, so not everybody does it. But however they start that conversation, most of them do come directly to us. They send mom's information through our HIPAA secure portal, and then we reach out, our peers reach out within 24 hours and then offer that different menu of services. However, we get, we have the talk and text line, people can text us, people can fill out an online form themselves, get lots of referrals from PSI. So anyway, but the majority of them do come directly to us from providers.
That's great. One last question for you before we get to the chat feature, or the questions in the chat feature question box. Tanya, tell us a little bit about the work that you do once a peer goes through training in your program to provide mentorship, and why that's important.
Sure. So and I would bet Erin could speak to this a little bit too, is just the ongoing support needed once a peer enters the workforce. Like we were talking before this started about, how peers are categorized and what that means, and are they real, we have social work assistants or whatever. So it can be stressful to work as a peer based on how structures are, how structures are set up, and we need ongoing support to ensure that peers continue to be successful. And so they have, it's that whole peer concept, right? And you could equate this even to a general workplace in that how you set up supervision in a clinical, how you set up how to process if something stressful happens. Well, peers need that space too, to have ongoing support. And part of it is that our agency, Mental Health America of Ohio, also provides peer training, and we have a support group that happens by peers for peers specifically for that too. So it's really not just our maternal mental health space, but all peers need that safe space where they can talk about anything in order so that they can continue to be successful.
That's great. Thank you, Tanya. And more to come on that sort of mentoring program as more starts to roll out around maternal mental health add-on training, integrated cohorts, etc. Follow 2020 Mom on our e-newsletter to learn more. One of the questions that's repeated in our question feature is, Mental Health America, will you be offering maternal mental health add-on training to all of us in our states? I think that's a great possibility. And Tanya, who's on the phone here, is going to be helping to lead that next step for an add-on training, and also working to integrate that training into cohort courses with RI. So more to come on that, and thank you for those good questions. I love that. I think because we're about out of time, I'm going to go ahead and turn it over to Madeline, who will wrap us up today. And if we have one last moment after Madeline gives announcements, we're going to ask our presenters today to give us any final words of wisdom or any last remarks you want to make. So Madeline, we'll turn it back to you.
Great. Thank you so much to all of the panelists. This has been incredibly informative. As a note of housekeeping, we will be sending out the slides and the recording to all of the attendees and registrants. And if you need to receive a certificate of attendance, please email mhalpern@mhanational.org with the webinar that you attended and your full name. Thank you.
All right, presenters, any final words of wisdom to peers, to Mental Health America affiliates, to other champions on the line? Erin, let's start with you.
Yeah, thank you. Because I was, Tanya, thank you for talking about it. I didn't realize how expansive your program was there, and it sounds wonderful. And it sounds like you're doing what I think we really need to do in the mental health field, in the peer support field, and that is collaboration. Collaboration with other entities, and not saying we're going to do it all ourselves, but how do we connect this? And as you were talking, I was thinking about peer navigation, and one of the things that is really that a peer with that shared learning experience, that shared lived experience of whatever situation that person is in, is that person also has probably utilized services that most places don't even know about. And now we have alternative services. Now we have services that are outside the norm. Services that maybe don't even need a referral, but here you go, here it is. And only people that have gone through that and who have had to navigate them on their own, which shows their own resilience. If anybody's had to navigate the healthcare system, it makes you very resilient just doing that. But, you know, finding all those other supports, I think that is wonderful. And to be able to mentor also, you know, we do a large piece on peer supervision, and I think you hit the nail on the head there, Tanya, when it's like, you know, we have supervision for all these different disciplines. And all the supervision looks very much alike across the board. You know, what does self-care look like? What does ethics look like? You know, all those things are elements in almost all supervision that we look at. But just like you don't supervise a nurse the same way you would supervise a counselor, or the same way you would supervise a behavioral health technician, peer support comes with their own set of skills. And the intimacy level that the peer support offers to the person that they're serving is oftentimes much deeper than happens in those 15 minutes that you have with your doctor or whatever. So sometimes, you know, the peer support hears the people at their worst moments. We all like to say yes, and then we just clear and put that aside, and when we go home, it's not a part of us. We all know that. Everybody sitting here and probably everybody listening knows that is not true. So, you know, that supervision and that support, that continued peer support in way of mentorship or peer-specific supervision is very important.
That's great. Thanks for just re-emphasizing that, Erin and Tanya, for the services that we know you'll be able to help provide or augment some of this. And of course, people always have to report into somebody on their paid employer staff, but to provide that community and mentorship outside of that relationship is going to be quite powerful. We had a couple additional questions that came in. And one is, can we repeat the email address, Madeline, if you would, for the certificate of attendance? If you could just repeat that one more time. And then Cindy, I'm going to turn it over to you next after Madeline repeats that email address to provide any closing remarks.
My email address is mhalpern@mhanational.org.
And we'll put that email address in the email that goes out with the recording that comes out from our platform provider here, GoToWebinar. We'll put that in the email as well, so you all can have it handy. And that's a little bit of a tricky email address, isn't it, Madeline? But thank you for repeating it. I think some people got that. So Cindy, any final closing remarks from you?
Yeah, you know, I think we've heard a lot from just the structural and the clinical standpoint, but from a peer standpoint, you know, I've always viewed peer support, especially for moms, as a fantastic model of mutual empowerment. You know, it's for the peer and the person receiving it, because as a peer, you're somebody that has recovered, and there is recovery in sharing your story, and you're empowered when you help somebody else, you know, because like Erin said, you know, you're very resilient if you've somehow found your way to recovery, you know, without a peer. But being able to extend that hand to someone else is healing for you while you're helping someone else heal. And so, you know, for me, from my perspective as a peer and a non-clinician, you know, I think it's just a beautiful model of mutual empowerment, which is what really moms need, you know, to utilize their experience, because a lot of moms especially feel voiceless when they're home with a crying baby and all that stuff. We're like, what am I doing? So I think this is just such a beautiful model in our space for maternal mental health.
That's great, Cindy. I wanted to add one more thing before we ask Tanya if she has any closing words of wisdom, is that because of the COVID crisis, and Erin, I know you hinted at some of this, really some of the findings as Cindy hinted at as well, out of the pilot study, was that it's difficult to be away from your baby. And so online training is really going to be powerful in this space. Of course, COVID has propelled all of us in that place, whether we like it or not. And Erin, do you I don't know if you want to talk a little bit about what RI is doing around tele-training, I want to say, not telehealth, but providing training online. And then also just to reiterate what some of us have spoken about before the session came out and went live, was that this training in maternal mental health, the cohort training with RI to start, will be available. We're aiming for definitely by next year, by 2021. And of course, every state is different, whether RI is in your state or another provider, and whether your state has sort of different requirements in place. So Erin, do you mind just touching on that briefly? Anything that I just mentioned before, Tanya, we turn it over to you.
Sure, and I find this really exciting because I know when Cindy and I first met and the first cohort went through, at that point I was the director for our private school, and recently I became the director for training internationally. So, and when I did, I took that over just as COVID hit. And so we took a lot of the lessons learned with the cohorts from 2020 Mom and just how well that online works if you do it correctly, if you allow the people to connect. And with all the platforms we have out there now, you know, you can break into rooms, you can have small discussions just like you could in a regular classroom. And what it really did for me, and as I move forward in looking at the design of how RI is going to continue peer support training and move into the future, and that is, it doesn't all have to be in person. We can do the online. We can look at developing what parts can be put asynchronously up there so it's self-directed. And then the important pieces that must be done in person, the role plays, the telling of the stories, the learning of the ethics, and those things that are really core, and the communication styles. We could really focus that then during the live training, the live piece of it. The other thing I think this showed us is we're able to compact what we do and present it in such a way that we can allow specialty trainings. I know we tried this with the VA, and it's been successful for over a decade with the VA, specialty trainings for veterans and veteran specific. Why can't we do that with 2020 Moms? Why can't we do that with other populations? How do we continue to integrate specialty trainings for specialty populations into the training that's already there? Because we do a lot of focus on self-development. And I think that's the piece that we really, that makes us stand out differently a little bit. And we definitely don't want to lose that, because that is a key portion. I know some of the reports that I read that came back from actually Cindy's class was, the one that we get a lot is, you know, you helped me in my relationship. Just taking this, learning how to communicate, it's helped me in my relationship. Wow, my marriage is so much better. So some of these things, you know, are really core. We don't want to lose those, but some of these things can also be presented in different ways. This working with the cohorts from 2020 Mom has really showed us we're capable of doing that. Now, how do we take that to larger audiences, and how do we expand on that and make sure that we can integrate all this wonderful stuff and work with organizations like 2020 Moms and with other organizations to bring specialty peer support.
Great, Erin. Thank you. So well said. Tanya, I have a little more feedback and some questions that have come in that I think will be a nice transition to you. A question came in about where else, besides like being in an institution that might be billing Medicaid, where else can I think about the possibility of finding a career? And I also want to just acknowledge before I turn it over to you that there are a couple other, at least I know at least one other mother that's on the line that provides peer support and doesn't work right now, in part because of the COVID situation, but is based in Kentucky and provided peer support bedside during labor and delivery, essentially. Really remarkable, and not necessarily trained in peer certification, but just want to point out that hospitals, especially for mothers, it seems to be are starting to be more progressive around looking for support, so care navigation and bedside type of support. So that's one thing I wanted to share. And then if you don't get plugged into a clinic or community-based entity that's billing Medicaid already, Tanya's program is a great example. There are other nonprofits that are doing this type of work. who aren't billing Medicaid but using grant funding. So I just stole your thunder, Tanya. Add to it, and anything else you want to share before we wrap up.
Yeah, absolutely. It's like that question was written for me, right? So that's something I always make sure to say, that while, we join with 2020 Mom in advocating for, reimbursement for peer services, and and certainly MHA National as well, and the advocacy around that. Our program, the POEM program at Mental Health America of Ohio, we are grant funded. We are grant funded by our local mental health board and our state mental health organization, and we will probably stay that way, even when even once reimbursement is provided for peers across the board in Ohio. Because we do focus so much on access. We focus so much on connecting. I mean, it's all through a peer delivery model, but it's about connecting moms to the services they need. And our agency has multiple services that connect people to the services they need, but the POEM program specifically for moms. But, and there are lots of entities that recognize how hard it is to get care, how challenging it is to get the right care at the right time. As a peer, I may recognize, gosh, I'm talking to this, this mom, and really she could probably use some clinical counseling, but if she's not ready for that, she's not ready for that. And that's not going to, it's about then me, meeting her where she is, and helping her to and then continuing to work with her until maybe she is ready, or until something shifts in her life. So I think there are so many opportunities and so many organizations around the country that are interested in how we can move outcomes. I mean, we spend so much money on healthcare in this country for such poor outcomes. And peers are a really, really good way, and access to care type services are a really affordable way to start moving people in that right direction. We know in our program that nearly 80% of the moms we work with, which is roughly about 2,000 a year, we know they get what they need. We verify that they connect to the service that's important and key to their recovery, and we can show those outcomes, and that's what providers want. So there's definitely lots of opportunities there besides being in a clinical space, for sure. And then I think I answered the question, probably over answered the question, as I'm notorious for doing. Just to say thank you. I'm grateful to be around 2020 Mom and RI, and Cindy, it's been great to hear your experience, and really just such fuel for continuing this work. And that importance of collaboration. I think that's key to a lot of our philosophies with working is let's bring people in that we can work together and create something really awesome. So I'm really grateful to continue this work.
That's great. Two closing remarks around, I think it was Susan Agallo from New Mexico. Welcome, Susan. Shared and raised this really incredible point that we didn't yet address, is that Medicaid ends for mothers, and I think all states at 6 weeks. There might be one state that it's 8 weeks. And so what are we doing from an advocacy perspective, right? Because peer support, if we're looking for reimbursement, would end at 6 weeks too. Really, really fantastic point. And you heard in our introduction that 2020 Mom hosts Mom Congress, and there's a great effort that's being spearheaded by many organizations that we get to be a part of, pushing forward to extend Medicaid to 12 months postpartum. That pregnancy Medicaid and birth Medicaid coverage through 12 months postpartum, that's happening at a national level. There's state advocacy opportunities. It's hard now with state budgets being cut. We really think the federal lever's the way to go. But California is one example of a state that just extended coverage for maternal mental health specific treatment for Medicaid through 12 months, even during the COVID crisis. So there are some levers there. And feel free to email me, joy@2020mom, if you have questions about that. We'll get you plugged into Mom Congress, even if you're not a mom, but a supporter. And with that, I'm going to go ahead and wrap up and share that here are our contact information. You're welcome to email any of us. about your questions, and we so appreciated the partnership with MHA. Thank you so much. And I also want to thank Patrick Hendry and Kelly Davis, who were part of the inspiration for us when Cindy first came to the 2020 Mom team, to know that we needed to do something here years ago, and they really helped plant the seeds to make what you saw today possible. So thank you to Mental Health America for a really incredible partnership, and more to come. Follow 2020mom.org, our e-newsletter, to learn how these developments unfold. Thanks to our presenters today. Thanks, Madeline, to you as well. Thanks, everybody.
Thank you.
Thank you.